Sciences and Shearing Oncology Biotech.
I'm Joey Pop. Welcome to HealthWise. As our region expands and attracts new people from around the world, hepatitis B and C continue to be a growing health concern. Well, what are these diseases and how can you be protected from them? And what treatment options are available? Well, we're dedicating this program to exploring these important issues during this broadcast. Returning to the show is Dr. Robert Reindaler, Medical Director from Carolina's Center for Liver Disease. During the past decade, he has conducted numerous clinical trials right here in Charlotte, all in an effort to evaluate treatment alternatives for those suffering from hepatitis B and C. Dr. Reindaler, what a pleasure to see you. Thank you so much for being here. He's joined by physician assistant Dawn Cunningham, his associate from Carolina's Center for Liver Disease. We'll also take your telephone calls during this hour. Our lines are open at 704-371-8895. Hepatitis strikes the liver, but let's first explore what the liver does in our body and how it becomes diseased.
Well, Joey, the liver actually is the largest internal organ in the body. The skin is actually the largest organ, but the internal organ, the liver, is the largest. And it has two basic functions. The liver is, number one, a filter, and it filters everything that goes through the body, goes through the liver. And number two, it is really the factory of the body. It builds a lot of body proteins. Now, when we look at the filter, first and foremost, anything that is absorbed from the gut, all the nutrients that are absorbed from the gut, anything that's not supposed to be absorbed from the gut goes through the liver, and the liver manufactures proteins from those things. But it also filters impurities, it filters toxins. And the other thing that's very important is every medicine that we put in our body generally goes through the liver and may or may not affect the liver. And as we all know, there's some medications that we take that have a history in some patients rarely causing inflammation of the liver. And so those we have to be also very much aware of. Then the viruses. Any virus that goes through the body can affect the liver. Some of the common viruses that give us the flu can occasionally cause a mild hepatitis. We generally don't know it because we don't get jaundice, and generally we don't check the blood work and know that the liver enzymes are up.
So everything that we take through our mouth or through our nose or whatever,
intravenously,
anything, the liver is like a filter.
It's like a filter, and so anything can affect the liver. So basically what we're talking today about are these viruses that affect the liver. And, as you know, we've primarily talked about hepatitis C in the past, but we want to talk about hepatitis B because it is a huge problem worldwide. 400 million people in the world that are infected with hepatitis B. 10th leading cause of death in the world is hepatitis B. Much less a problem in the United States, but it's something we want to talk about and focus on tonight. But very quickly, I want to mention the other viruses. Hepatitis A is the old infectious hepatitis, and you get it from the oral fecal route. You occasionally hear about food handlers in the produce section that have hepatitis, and then everybody that's gotten produce from a certain store has to go and get gamma globulin or immune globulin to be protected from hepatitis A. That is one that never goes chronic. Hepatitis B we're going to talk about is old serum hepatitis, and it is contracted through IV drug use, very easily through sexual transmission, and can through needle sticks of any kind if needles are not properly sterilized in the dentist's office or something like that. Hepatitis C is a huge problem in the United States. 4 million people are infected with hepatitis C. The problem with hepatitis C is that the majority of patients who contract hepatitis C, it goes chronic. And then hepatitis D and E are the last two very quickly. Hepatitis D only occurs in hepatitis B patients. It's a defective virus, and rarely in patients who have hepatitis D or hepatitis B, they will also be super infected with hepatitis D. And hepatitis E is very much like hepatitis A. It occurs in third world countries, India, Mexico, parts of the world, through drinking contaminated water.
Dawn, I wanted to ask you, we opened this broadcast that as our region grows, perhaps we're seeing more of this health concern. Why is that?
With hepatitis C, first of all, we're seeing more, not because more people are being infected, but because we're doing a better job of awareness and getting people tested, and there's more people being diagnosed, where actually there's probably much less people actually being infected with hepatitis C, because we have done a good job with public health efforts. In hepatitis B, we are seeing a little bit more of a resurgence here in the United States because of influx from people from the Far East and things like that. We did see initially a decrease because of vaccination efforts. All children now are vaccinated as they're born. One of the populations where we're starting to see some hepatitis B, even here in the community, is in our college students and things like that, because it is sexually transmitted, and people who are college age right now were not vaccinated when they were infants. So there's sort of a catch-up game going on in getting people vaccinated for hepatitis B.
How is someone diagnosed, and what are the symptoms?
You know, it's very interesting, because if you look at hepatitis A and hepatitis B, the ones that are most frequently diagnosed are the ones who present with a syndrome of hepatitis. They present with a flu-like symptoms, they have nausea, vomiting, they lose their appetite, and then they get jaundiced. And they go to their doctor, and their doctor does blood tests that differentiate hepatitis A and hepatitis B. As I said, hepatitis A, invariably, if you get it, you get over it. If you're not elderly and you're not, you don't get a rare case of severe hepatitis A. Hepatitis B, only 5% of patients who get acute hepatitis B with jaundice actually go chronic. And you know,
what was that percentage again?
About 5%.
Only 5%.
Only 5 and 10% max go chronic. So no patients with hepatitis A go chronic. Only 5 to 10% of patients with hepatitis B go chronic. And unfortunately, about 85% of patients with hepatitis C go chronic. Now, to answer the question more about how do we make the diagnosis, again, hepatitis A and B are the ones that present with jaundice, the yellow eyes, and then they present to their doctors. The majority of patients who have chronic hepatitis B never ever had a clinical case of jaundice and acute hepatitis, and so they may present to their doctor with elevated blood tests, the liver enzymes. Hepatitis C rarely presents as jaundice. In fact, in the last several years, I've had 2 patients who had acute hepatitis C with jaundice. The vast majority of the patients that we see were infected from IV drug use 25, 30 years ago, intranasal cocaine use, blood transfusions before 1990, 1991, when we started to screen for them. So the majority of patients now with hepatitis C are diagnosed because they had a physical for insurance purposes, and the insurance company found they had hepatitis C. They went to the American Red Cross to donate blood, and they identified that they had hepatitis C. And now they have to revisit something that they did when they were very young as a teenager, such as experimental drug use. And now they're having to look back and say, oh gosh, what did I do?
That has to be shocking.
Very shocking.
My goodness. And I guess this is just another reason why, if you do have a flu-like symptom that lasts a longer than normal time, that you really do need to see your doctor, because you never know what could be wrong.
That's right. And the other thing that I want to point out is that patients who get drug-related hepatitis, rarely if you have an antibiotic, or you're taking an antibiotic for a cold, or if you're taking one of these cholesterol-lowering drugs, and they're all marvelous drugs, very, very good drugs, but rarely they can cause drug-related hepatitis, an inflammation of the liver. And again, if you're on a medication and you present with a flu-like symptom and your doctor sees your liver enzymes go up, the first thing we do is, what medications is the patient taking?
Sure.
Because any medication can do anything to anybody.
And another reason why doctors are testing the liver once you are put on a medication initially, or you should be, correct?
Well, certain ones, and those would be, again, the cholesterol-lowering ones, the statin drugs, and some of the antibiotics. And then there's some that are taken for arthritis, that we check the liver enzymes. One of the other questions comes up, what if I have chronic liver disease, and or if I have cirrhosis, or I have chronic hepatitis C or B, am I at greater risk for getting a medication-related hepatitis? And the answer is no. Many patients, once they have chronic hepatitis C or they have cirrhosis, their doctors are afraid to treat them with anything. They are not at greater risk for developing a drug-related hepatitis. Clearly, if they get a drug-related hepatitis, it can be more serious. But again, most patients can take most drugs, even if they have a chronic liver condition.
Great. It's such a public service for you to be here tonight, both of you. I appreciate it so much. We're going to take our first call. We have Billy from Waxhaw. Hi, Billy.
How you doing?
Good. Your question for Dr. Reindaler and for Dawn.
Okay, I have chronic hepatitis C with residual and thrombocytopenia with platelet counts between 40 and 50K with cirrhosis. and the doctor will not give me interferon because they say it may rush to end stage. And they say there's really nothing they can do for me at this time. Do you have any thoughts on that?
Okay, thank you for the question. And he's asking some pretty technical stuff that's over my head. So explain what he's asking and how you can answer the question.
Billy, you know, the problem that Billy has is that he has a low platelet count because he has cirrhosis of the liver. And when you have cirrhosis of the liver, remember, we said all the blood goes through the liver as a filter. Well, when you develop a scarred cirrhotic liver, that filter gets clogged up. The blood backs up, and it backs up into the spleen. The spleen gets bigger, and all the platelets become sequestered or hide out in the spleen that is now enlarged. And so the platelet count drops. Unfortunately, interferon that we give for hepatitis C lowers the platelet count. Now, this is, we can give interferon, and sometimes we can give it at low doses and start at very, very low doses and then work our way up. The medicine that we give, ribavirin, the pills that we give with the interferon for hepatitis C actually helps raise the platelet count. So sometimes that helps. And we actually will tolerate a platelet count on interferon down to about 30, 35,000 or 40,000. One of the things that we have done that is very controversial, if patients have no other health issues, if patients are in excellent health, and they do not have decompensated liver, their liver is very, very good, we occasionally will have one of our laparoscopic surgeons at Carolinas Medical Center, Dr. Kent Kirscher, to do a laparoscopic splenectomy. And this is very controversial in the past, but we have now had about 10 to 12 patients who we've removed the spleen, the platelet count goes back to normal. Then we can treat the patient with interferon, and I can tell you that 8 out of the first 10 patients that had splenectomy have either permanently lost their virus or are on treatment and have lost their virus. The first 2 we did that to actually have been cured of their hepatitis C. Now, not everybody's a candidate, and not every surgeon should be doing laparoscopic splenectomies for these patients with cirrhosis. But Dr. Kent Kirscher has really achieved a lot of experience with these patients and does a phenomenal job.
The other issue he brought up was the potential of developing liver failure in a cirrhosis patient who is put on interferon. And that is something that certainly can happen. It certainly is a risk. But in most patients, even with cirrhosis, they are able to tolerate the medications very well. But it is a potential risk, and that's a good point to bring up as well.
Okay, Billy, thank you for calling. We're going to go over to the Gaston County, and we have Angela from Belmont. Hi, Angela.
Hey, how are you tonight?
We're good. I hope you are.
I'm doing pretty good. I've been a little sick lately, but otherwise than that, I'm doing fine. I'm a hepatitis C carrier. I'm a genotype 2. And my main concern is I've been having some problems with the female organ system. I'm doing a lot of heavy bleeding and everything during my period, but I cannot find in my county anybody that will help me get a hysterectomy. Is there any way that you can give me some information or someone that I might refer to?
And is this something that you would recommend?
You know, Angela, tell me, have you had a liver biopsy? How serious is your hepatitis C?
I've been treated for the last year with Revicon and interferon injections. I take the injections 3 times a week and 3 tablets a day.
Do you have cirrhosis?
I have fibroids. I have it's fibroid. It's hard.
You have fibroids of the uterus. Now, what about your liver? Do you have a scarred liver?
Yes, I'm functioning only with 1/3 of my liver now.
Have you had problem with your platelet counts and anemia or anything like that during treatment?
Just mainly last couple of months I've had a couple operations and it's brought everything down.
What I would suggest is that you have your gastroenterologist or your liver doctor talk to your gynecologist. And generally, you know, we have a number of surgeons who, for instance, have had a lot of experience now taking care of patients who do have cirrhosis of the liver and operating on them. Of course, they're concerned about the bleeding complications that can occur during surgery because you have a scarred liver. So I would have the doctor talk to your gastroenterologist, and also they can have a hematologist provide platelets or fresh frozen plasma or the blood clotting factors during surgery to help you prevent you from bleeding while you're having surgery. It's doable. It is very doable if you need it, but certainly that you can find someone that can do it in this community.
Okay, let's say they don't want to go with the surgery for the hysterectomy. Is there any other way that I could go about having the menstrual cycle stop during this process so it wouldn't bother me as much with the treatment that's going on with the fibroids?
Angela, I have to tell you, I know nothing about OBGYN. Like Miss Prissy, I don't know nothing about birthing babies. And so I really can't help you there.
You'll need to see your doctor. Angela, thank you so much for calling tonight. We hope this show has helped you become more health-wise. We're going to go down to Union County. Hi, Robert.
Yeah, how you doing?
Good. Your question for the doctor.
Yeah, my question is, what about silverware? I have a dishwasher, and just believe it or not, ironically, right before the show come on, I was thinking I need to start washing my dishes with my hand because my dishwasher ain't getting it so clean, and my dishes, my spoons and forks and stuff be dirty all the time. Would that cause any kind of hepatitis?
Assuming that this dishwasher is hot enough to kill germs, should there be a concern for that?
No, and I'm going to let Dawn answer that question.
No, there shouldn't really be a concern. And even this sort of brings up the household contact issue. A lot of people are worried, you know, if we have, say, a lady who comes in and she's in her mid-50s and she has some grandchildren, she's always worried about what if the kid picks up the cup after me, what if my grandbaby does this or that or the other thing. And with hepatitis C, it is not transmitted that way. It's specifically transmitted through blood. So there is no risk in transmitting something like hepatitis C after using silverware or drinking out of a cup or anything like that. Hepatitis A is a little bit of a different story, and you'd really only get that in a case where there is hepatitis A around. And here, just small outbreaks every once a year or something, we see that around. So that's not really a risk if there's someone with hepatitis A in the household. And hepatitis B can be in other body fluids, and we do recommend vaccination if there is somebody in the household who does have hepatitis B, that everyone in that household be vaccinated so that they don't have to worry about things like who picked up a fork after somebody.
And on those same lines, as a reporter, there have been stories that I have covered in my career where, yes, people are having to be vaccinated because they did go through the cafeteria line where a worker working the salad bar apparently did come down with hepatitis. How dangerous of a hepatitis is that when we're talking about, what, hepatitis C, which is through the blood?
And again, that's hepatitis A that came through oral fecal route. Hepatitis C is, again, we want to make over and over and over the point that you can't get it from another person. Even sexual contact is a exceedingly rare cause for transmission of hepatitis C. For instance, the head of the CDC Hepatitis Division of Epidemiology, Dr. Miriam Alter, will tell you that the sexual transmission of hepatitis C isn't zero, but it's awfully close to zero. And I can tell you in 25 years of practice, or close to that, I've had one sexually transmitted hepatitis C case, and that was a patient who had her first sexual encounter with a gentleman who had active genital herpes, so it was blood to blood. So what we generally tell people with hepatitis C with sexual transmission is you do not have to change your practices with long-term partners. If one of the partners has an outbreak of genital herpes, you always use safe sex precautions. And thirdly, if you are dating somebody and you're having any sexual contact, obviously if you don't know them, there are other things that are far worse than C that you could get from them, so you should always use safe sex precautions. Again, from drinking after somebody, kissing somebody, you just can't get it that way. One of the most tragic things that I have seen that I want to talk about over and over to the community out there is the patients with hepatitis C who lose their jobs when the people in the workplace find out they have it. And they go to their boss and say, I'm not going to work around this patient that has a hepatitis, or the boss does the same thing. It is ignorance. It is something that we have been on here year after year after year talking about. It is something I'm very passionate about, something that makes me very angry, because I've seen many people lose their jobs. Even people in the kitchens cannot transmit hepatitis C to people that are eating in the restaurants. And if we knew what the patients or what the cooks were carrying, probably none of us would ever eat in a restaurant, including the finest restaurants in this town. So it's one of my pet peeves. And please, if you employ people and someone has hepatitis C, they need compassion. They don't need to be booted out of their job.
Hepatitis A, going back there though, for someone to come down with hepatitis A, that's an acute hepatitis. Can it become chronic though?
No, again, hepatitis A never goes chronic, and that's wonderful. The people that are really at risk for developing a severe hepatitis A would be the elderly and the very young.
Or someone with chronic liver disease.
Or someone with chronic liver disease. And that brings up another point that Dawn wants to tell you about.
Dawn, it's all yours.
Me and my vaccination fixation here. But no, anybody who has any type of chronic liver disease, whether it's hepatitis B or hepatitis C or just cirrhosis from an unknown cause or fatty liver disease, should be vaccinated against hepatitis A because their liver already has an insult and it may be more difficult for them to deal with a virus that the rest of us could tolerate very easily. There is also a combination vaccine out now that will vaccinate you against both hepatitis A and B, which is much more convenient because it's a lot less injections for patients.
Great, Dawn. Thank you. Let's go to Joan right here in the Queen City. Hi, Joan.
Hi.
Your question for the doctor and Dawn.
Yes, I have a question regarding taking the treatment for hepatitis C and it causing severe itching of the skin, and the different over-the-counter things that we've tried aren't working, and I was just wanting to see what your thoughts are on that, and I'll hang up and listen. Thank you.
Thank you.
There are a few patients who do have some trouble with itching, different rashes and things like that on treatment for hepatitis C. It can be caused by either of the drugs we use. It can be caused by the injection that they're taking once a week, which is the interferon, or by the ribavirin pills that they also take. We've had great difficulty with some of these rashes and trying to find things that work. Sometimes some of your typical allergy medications can help take the edge off that. We tried the oatmeal baths and things like that, but there are some patients that we just do not have the answers for some of the itching and the rashes that occur with the treatment.
Joan, I hope that helps. Let's go to Polkville. We have Carrie. That's just above Shelby, right, Carrie?
Opal.
And where are you located? What county?
North Carolina.
What county? I'm sorry.
Opal, North Carolina.
Okay, Carrie, your question tonight.
I've had hepatitis C for years. I didn't realize I had it, and I've got a 14-year-old daughter. Now, when she was born, I wasn't sure whether she could get it or not, be delivering her. And the doctor put her on some medicine, which did give her yellow jaundice, which messed her liver up. And I was wondering if all my health problems, I've got emphysema and COPD and lots of, I'm in a wheelchair and oxygen and all that. If I have sex with another man, is there any way that he could catch it?
Thank you for the question tonight, Carrie.
A lot of questions there. The first one, what is the risk of a mother passing this along to her child or your child at the time of birth? And that would be less than 7%. It's a little higher when a mother is co-infected with the HIV virus, but for the most part it is very rare, and the easiest thing to do is just screen your child for hepatitis C, and the vast majority will be negative. Now, they may have some of the antibodies within the first 3 to 6 months of birth, maternal antibodies, and they will go away, and then they will check them again at a year, and they'll find that the child doesn't have hepatitis C. So we generally don't check a child till at least a year after birth or thereafter. But again, if it's a concern, just check the child and they'll be negative. The other thing again is the sexual transmission. It is very difficult to sexually transmit this virus. It would be blood to blood, sex with trauma, sex with herpes, or a venereal disease would be an obvious way that could occur. But again, I've had only one patient in all my years in which there was a sexually transmitted hepatitis C.
Is this common? At the beginning of her question, she said she didn't know at the time of her daughter's birth that she had chronic hepatitis.
Sure. And again,
so once again, what would have been the symptom, or eventually she would have just gotten diagnosed by a routine health check.
And the majority of the patients don't have any symptoms. And of course, when they come to me, they're horrified because the first thing they want to know is, did I give it to my child? The second thing they want to know is, did I give it to my loved one? And the majority of patients have no symptoms. And they don't have symptoms unless they develop advanced liver disease. And fortunately, only about 25% of patients over 30+ years will develop cirrhosis.
But Dr. Reindauer, that's scary, isn't it?
It's very scary, and unfortunately, the majority of the patients that come to us have had to wait several months to get in, and the first time they see us, they're very, very frightened. You could swear that they've been told that they had HIV, and so the first time we see them, we get a very complete history, and then my job is to assure them that the greatest chance is that they're going to live to be 80 or 90 and die of something else, whether with or without hepatitis C.
Wow. Susan from Charlotte, welcome to HealthWise.
Thank you.
Your question tonight.
My question is, I'm a cancer survivor and have gone through 8 cycles of chemotherapy, and subsequently each one accompanied by a CBC. They were all fine. I never missed one. However, when I finished that course of treatment and had another CBC about a month post, my liver enzymes were off the wall, completely, just off the chart. And I was tested for hepatitis and told I didn't have it. And I just wonder if this is something that happens to people that go through chemotherapy.
Is she an isolated case in that respect?
Yes. Many of the chemotherapy drugs, we talked a little bit about drug-related hepatitis. Many of the chemotherapy drugs can cause a drug-related hepatitis, and this usually does resolve over time after you're off the chemotherapy drugs.
Susan, I hope that helps. We're going to stay in Charlotte. We go to George. Hi, George.
Hello.
Hi, your question tonight.
Yes, sir. I just got recently married, and it's not my first marriage for my wife or myself. So sex has not been an issue, and my wife just started birth control, but they're not effective yet. So we've been using a condom for, intercourse. But now my wife has interest in having oral sex, and I'm concerned about transmitting the hepatitis B, virus to her. I want to know if that would be possible or not, or should I wait? That's my question.
Now,
thanks, George.
Yes.
George has hepatitis B.
You said
Yes.
B, right?
Yes, hepatitis B.
B.
Again, most of these things are very difficult to get through oral sex. I mean, most of these viruses are, unless there was a break in the skin or in the mucosa, the lining of the mouth or whatever. If there was a break, so it would be difficult to get that through oral sex. However, through regular sex, hepatitis B is very sexually transmitted. And we want to make the point that if you have a hepatitis B, if you have acute hepatitis B, or if you have chronic hepatitis B, your sexual partners should be checked. They should be screened for hepatitis and be given appropriate vaccination. So again, the major issue here is that, George, your new wife should be vaccinated, and if she's vaccinated, then this won't be an issue.
I hope that helps, George. We're going to stay in Charlotte once again. We have Terry now. Hi, Terry.
Hi, how are you?
Good. Your question tonight.
I went to go get blood. Y'all gave us some similar scenario earlier and got a letter back saying that I had hepatitis B antibodies, and therefore I was not able to give whole blood. I can only give plasma. I guess my question is does that ever develop into hepatitis B once you have the antibodies?
And before you say goodnight, were you shocked when you got this letter?
Oh, very.
And you went right to your doctor?
I did.
Yes, okay. Thank you for your call tonight.
This is something that comes up not infrequently. Patients are found to have antibodies to hepatitis B. This is where it gets a little confusing between hepatitis B and hepatitis C. With hepatitis B, if you have antibodies to hepatitis B, this generally reflects prior exposure and immunity. So you do not have active virus, and you're immune to the virus. You were exposed somewhere in the distant past, and it's not a problem. Now, that having been said, there are rare patients who have antibodies to the virus and have had prior infection, and there may be laying dormant very small microscopic amounts of virus. For all practical purposes, you do not have the virus. But patients who get AIDS, patients who get immune suppressed from cancer treatment will rarely, if they've had prior exposure to B and have immunity, have a flare of their hepatitis B. Now, that is very, very rare. But for these patients, the way we should look at these patients who have antibodies to hepatitis B is that they are immune, they've had prior exposure. Now, of course, the other question I have to ask is whether she was ever vaccinated for hepatitis B. But again, she sounds like she's of the age, my age, and that, although I shouldn't say that, I don't know. And that's terrible, you know. But anyhow, she, you know, again, you know, now all children are vaccinated at birth. And we recommend that all children that have not been vaccinated, that are going to school or college, all recruits into the service, you know, get vaccination. All healthcare workers working in hospitals get, you know, vaccinations for the most part. And so more and more people should be vaccinated. I hope I dug myself out of that one.
And Terry's no longer with us, so maybe she'll call back. Our half hour's gone. We still have another half, so please stick around. You're enjoying HealthWise on WTVI.
An educational grant for HealthWise is provided by Gilead Sciences and Shearing Oncology Biotech. If you would like support group information about tonight's topic or any HealthWise topic, call SupportWorks at 704-331-9500. For more information about tonight's guests, call the HealthWise information line at 704-371-8836. WTVI welcomes questions and comments about HealthWise. You may write us at HealthWise, care of WTVI, 3242 Commonwealth Avenue, Charlotte, North Carolina, 28205. Or you can email us at healthwise@wtvi.pbs.org.
Welcome back to HealthWise. I'm Joey Pop. Our topic today is on hepatitis B and C, prevention and treatment. With us are Dr. Robert Reindaler and physician assistant Dawn Cunningham from Carolina's Center for Liver Disease. Remember, we're taking your questions at 704-371-8895, and we've had some fascinating questions. People out there really want to know about this, not only B and C, which we're concentrating on tonight, but you explained to us you have A, D, and E, correct? So it can be very confusing, can it not?
It's confusing. I had to do a liver fellowship to figure it out, I have to tell you. And it really is, it can be confusing. But for the most part, the ones that we see in this country are A, B, and C. D is found primarily in the Middle East and in parts of Southern Europe, and it usually occurs with hepatitis B patients, or always occurs with hepatitis B patients in IV drug-using populations is the generally place we see D. E, we will occasionally see patients in this country who have gone to third world countries and come back with a hepatitis and are found to have hepatitis E. Generally, this is not passed from one person to the other like hepatitis A or infectious hepatitis. This is from drinking contaminated water. So patients that go to Mexico, India, Africa, and places, third world countries, that's where they get E.
Dawn, what vaccinations or what treatment, I should ask, are out there for, especially for hepatitis B? What treatment?
Hepatitis B, there's several newer treatments out, which is very nice because the old treatment that we used to use for hepatitis B was interferon. And when we talked about hepatitis C, we talked about a lot of those side effects associated with interferon. We now have oral medications for hepatitis B, which is nice because the patient doesn't have to give themselves an injection. And for the most part, these medicines don't really have any side effects. They just need to take one pill once a day, and they're treated for their hepatitis B with that.
One of the things that I would like to point out is that with hepatitis B, again, only patients who have chronic liver disease and have related to hepatitis B, only those individuals who don't have acute hepatitis, they've gotten beyond the acute hepatitis and now they have chronic hepatitis. In other words, they've had it for greater than 6 months, they have elevated liver enzymes, and they have very high viral loads in the blood. These are people that we do a biopsy on, and we document that they have chronic hepatitis B, inflammation with or without scar. And these are individuals then that are candidates for treatment. So if you have acute hepatitis B, we don't need to treat them. The other thing is that with the chronic hepatitis B patients, the interferon, about 40% of the patients we could get into remission. But these are 40% of patients who fit a very, very narrow, what's the word? I mean, they're just a narrow group of people. They have to have pretty high elevated liver enzymes, and their viral load is not sky high. So it's only a limited number of people who actually are candidates for interferon. Interferon in those people works very well, and about 40% of them we can put into remission. For using the oral agents, and there are two of them, lamivudine and the newer adefovir. And the first one that came out was lamivudine. And again, they suppress the virus very good, and about 18% of the patients will go into viral remission with the lamivudine. The problem with the first drug is that after a year, we start to see the development of mutant strains. So the patient's virus is suppressed, and then at about month 12, you start to see the virus come back in some patients. At that time, it's only about 12% of patients to 20%. And the mutant is much less virulent. It's not as serious, but it can over time cause chronic inflammation. The newer drug, adefovir, is very good when the lamivudine fails or by suppressing that mutant strain. And adefovir, for the first 48 months has not, that it's been tested, has not been associated with mutant strains. That's not to say that the longer it's out, we won't see mutants with that as well. So the oral agent's very easy. They don't have the interferon-related side effects. They suppress the virus very good. The only problem is with the first one, you can get the development of some mutant strains. The second one can suppress those, and we're doing research at our office now for chronic hepatitis B patients on newer medications, and we're finding newer drugs all the time. So that's wonderful for hepatitis B. Hepatitis C, we need a pill.
The other thing, and a lot of patients who don't have any symptoms of their virus, they ask, why do I need to be treated? And one of the big issues with hepatitis B, that it's a bigger problem than hepatitis C, is a lot more patients will progress to cirrhosis, and there's also a very high risk of liver cancer, hepatocellular carcinoma with chronic hepatitis B. So those patients that do have active virus really do need to be treated, even if they don't have any symptoms of their virus.
We have Jane in Charlotte calling tonight. Hi, Jane.
Hi.
Your question for the doctors.
I actually have two questions.
Yes.
One is dealing with the herbal or alternative treatments like milk thistle and, of course, alternative lifestyle. The second one deals with insurance issues after you are either diagnosed or treated for hepatitis C, like the maybe changing jobs and the concerns of insurance after that.
Right, being labeled.
Yes.
Okay, very good questions there.
First, the herbs.
Yep.
You know, there is a lot of people out there that are very interested in alternative medicines and alternative, what do we call it, Dawn? Complementary medicines. And in fact, there are so many of these that are being used that the NIH has taken on as one of their focuses, looking at these to see what is the good of some of these agents and these things that you can get through health food stores like milk thistle and some of the others. Not to mention the fact that there are a couple of them which can be hepatotoxic. And so, number one, a lot of patients come to us, they're on these. I'm very liberal. I feel that if patients feel like they want to be doing something, as long as it doesn't hurt them, I don't have great problems with taking these complementary medicines like milk thistle. My major problem is that a lot of patients are spending a couple $100s a month on these, and they have not been proven to do anything to the virus or to help the liver. Now, there are going to be some studies in the future, not a doubt about it, with milk thistle, because milk thistle is one that everybody is taking, and the liver enzymes do seem to improve. So there'll be studies to look to see, does it do anything to the liver? I'm very concerned that milk thistle is going to be on the endangered list of plants in this country because everybody's taking it. But it is one of those. So again, I don't have a problem, but there you can go to the NIH website for complementary medicines, and you can see, make sure that you're not taking one of the ones that can be toxic to the liver, because some of them can. The second question is insurance issues. It is a huge problem. And, you know, when we started being able to cure patients with hepatitis C, and I'm happy to tell you that about over 50% of patients now that we treat will be cured of their hepatitis C. And in some groups of patients, that's up to 70 and 80%. That having been said, we, you know, thought certainly insurance will not be an issue once they're cured of hepatitis C, and we send the insurance company, if it's a life insurance, they want to get more life insurance or whatever it is. Fact of the matter is, it continues to be a problem. And the way the insurance companies look at these patients are, okay, I don't care that they're cured. This is a high-risk individual. They had hepatitis C in the first place. They're a high-risk person. So it's an ongoing problem, and it's a frustration of all of ours.
It certainly sounds like it. Let's go to Deborah in Shelby. Hi, Deborah.
Hi, how are you?
Thank you for calling from Cleveland County tonight. Your question.
Actually, it's just a statement. I am a patient of Dr. Reindaler, and I have done the interferon and ribavirin several years ago and cleared my hepatitis C. Have been cleared for probably 4 years now. Dr. Reindaler is a brilliant person. His staff is just phenomenal. These people out here that have this need to know that there is life after a diagnosis. Just take with it what you get. It's just a life-changing thing. If you can just take it with a grain of salt that maybe, you know, this is a learning process. Also, take charge of your body, take charge of what's happening with you. If you don't understand something, make it your job to understand what they're telling you. But just for these people out here that are probably feeling hopeless, just let them know that there is life after it, and it's a good life.
Deborah, thank you so much for putting this in a nutshell, because I think that's the message that we've been hearing this hour, is that this is a disease that you can live with.
Yeah, you can. You can live with it. The treatment's not a fun treatment, but it's an okay treatment, and I wouldn't trade what I learned from this for anything in the world. But anyway, Dr. Reindaler, you're brilliant, your staff is brilliant, and you just keep up the good work. I'll see you later.
I have to thank her for calling, and the only important thing she said, or the most important thing she said, has to do with clearly, you know, that you can live with hepatitis C, you can be cured with hepatitis C, and you can be the better for it. I mean, and that's what I see. And again, patients come to me, and I remember Deborah the first time she came to me, and I did not pay her to say these kind things, but the first time she came to me, she was as concerned as everybody else. And most folks come and they think, is my life shortened? They certainly believe it's changed forever. And this is an individual who was cured of her hepatitis C and who now tells you she's better for it. And she has a total different perspective about her life having been through this. So there's a lot of good treatment out there. It's not always easy. It's not always a walk in the park, but it's worth doing.
But it is constantly life-threatening, or is it not?
No. What's that, Joey? The treatment or the disease?
The disease.
No. And again, you know, we have to tell you that this is a very, very indolent infection. Unlike hepatitis B, when it goes chronic, hepatitis B can march right along to cirrhosis and then ultimately liver failure. So it's very important these patients get treated very quickly.
That's the reason why they must be treated.
That's right. Hepatitis C, on the other hand, is a disease that is very indolent. And most of the patients that we see have had this for 30 years, since they were teenagers and did some things that weren't what they would have done now, and such as experimental drug use. But some of the patients have had blood transfusions, and some we don't know where they got it. However, when we see patients in the office, less than 20% will have advanced fibrosis or scarring of the liver. The majority of them still have mild disease. And this brings up another point, that a lot of patients have mild disease, and a lot of doctors out there will not treat because they'll say, you know, over the next 10 to 20 years, you're not going to get in trouble. This patient feels like their life has changed forever. And I believe when we can treat and cure over 60% of them, they deserve a chance to be treated if that's what they want, even though they're not at risk for severe disease for the next 20, 30 years.
Let's go to York County. We have Elaine. Hi, Elaine. Welcome to HealthWise.
Hi.
In Rock Hill, right?
Yes, I have a fatty liver. I was wondering if I should be taking the A and B vaccine, and I didn't know the fatty liver was a disease. Is it progressive, and how is it treated? I've never been treated for it. I've never been a drinker. And with the fatty liver disease, are my chances higher for hepatitis viruses?
Elaine, thank you for the question. What is she talking about first off?
We'll let Dawn.
What is that?
And to start off with, she said she didn't drink, and that's an important distinction. We used to think if somebody had fatty liver disease, they drank. Even if they didn't admit it, they were hiding in the closet somewhere and drinking. But now we know that that is absolutely not the truth, and that there is an entity of what we call non-alcoholic fatty liver disease, where patients can get fatty liver disease. It's a group of patients that stereotypically has what we call central obesity, meaning most of their overweight is right in the middle. A lot of them will have diabetes. If they don't already have diabetes, they're very likely to develop diabetes down the road, and a lot of times have trouble with high cholesterol as well. The good news is that majority of these patients will not progress to more serious liver disease, but many of them will. They can progress to actually have cirrhosis and liver failure, even if they don't drink and even if they don't have any of the hepatitis viruses. So it's important to get evaluated, to get a liver biopsy, and to find out if you have any scar or inflammation in your liver so that you know what your chances are of progressing in the future. The biggest things you can do to treat non-alcoholic fatty liver disease are to take care of some of the risk factors, to get your cholesterol under good control, to have your blood sugars under control, and follow a good diabetic diet, even if you don't already have diabetes, and to get very regular exercise and to eat healthy. A lot of our patients will also supplement with vitamin E, which can help with the way the liver processes fats and help with the fatty liver disease as well.
Hope that helps, Elaine. Let's go to Diane right here in Charlotte. Hi, Diane.
Good evening. Yes, my question is about hepatitis A. May I ask a question about that?
Yes, go ahead.
About 20 years ago, I was living in Africa, and I got hepatitis A. I recovered from it, and my understanding is that there are no long-term effects, and that's my question to you is if there is, and if you have had any type of hepatitis, can you be an organ donor and can you give blood?
Thank you, Diane.
First and foremost, Diane, you had hepatitis A, you got over it, your liver's perfectly fine, and there's nothing wrong with your liver. There's no residual inflammation, there would be no residual scar, and you are not at risk for anything. And yes, you can be a organ donor with hepatitis A, as I understand that.
Right, but I do believe that the Red Cross does not allow you to donate blood.
If you've ever had hepatitis.
If you've ever had hepatitis. Right. So blood donor, no. Organ donor, yes.
Interesting. Let's go to Robin in Charlotte. Hi, Robin. Your question tonight on HealthWise. Okay. Robin may call back. Let me ask you, is there a connection, because I was researching this on a website, and they mentioned high cholesterol, and I noticed, Dawn, you had mentioned this earlier, high cholesterol and the vaccine. Is there something there? And while we're talking about the web, should we believe everything that we see on these websites? Is there a concern, first off, with high cholesterol and hepatitis?
Occasionally, patients that have severe hepatitis can get a high cholesterol. We really don't, that's not a problem. Patients with a certain type of chronic liver disease called primary biliary cirrhosis. This is usually seen in women. It's an autoimmune disease of bile ducts. And this, in fact, can cause a high cholesterol. And they can have very high cholesterols. But that is the only patients, a group of patients that we see that where it is a huge problem. Now, it brings back up this group of fatty liver patients who have high cholesterol. And patients who have...
And on the verge of being type 2 diabetics. That's right. So I would think that's a pretty substantial population. Let me tell you something. Especially the middle-aged folk here.
Let me tell you something. When I got out of my liver fellowship, I was told by my colleagues, you're crazy, you're only going to take care of alcoholics. It was never primarily alcoholic liver disease. In the 1989, we discovered this hepatitis C virus. In the 1990s, we found that over 4 million people were infected with C, and we thought that was the predominant liver disease in America. It's not so. About 20% of the American population has some degree of fatty liver. And on this spectrum of the 20% of the American population that has fatty liver, 20% actually have inflammation and in scar, and that's called NASH. The big group are called NAFL, non-alcoholic fatty liver, The small group is called NASH, non-alcoholic steatohepatitis. And as Dawn pointed out very well a few minutes ago, that group of people are at risk over 30 years of developing cirrhosis of the liver. Again, these are people that have high cholesterol. These are people that are obese. These are people that have diabetes. We use vitamin E because it helps insulin resistance. We're starting to use some of the oral agents that actually treat insulin resistance, and that helps fatty liver in these patients. But again, this is a group, this is the biggest problem in America today with liver disease, the most important liver disease actually in America today.
So it's not just high cholesterol being a concern for your heart and for stroke, but for liver.
That's right.
Fascinating. Let's go back to Gaston County in Dallas. We have Steve calling tonight. Hi, Steve.
Hi, how you doing?
We're good. Hope you are.
Oh, I'm doing great. I'm a recent patient of Dr. Ryan, and I'm also on the board of the Central Carolina Liver Association.
Very good.
And I was wanting to let everybody know that, you know, it is a tough thing to go through the treatments and all, but there are some of us out there that care, and we have a meeting at Carolina's Medical Center on the 3rd floor, dining room 1, the second Tuesday of every month. And this Tuesday we'll have a meeting, so if anybody needs somebody just to talk to and has any questions about it and might need some support in their treatments and all, we're there for them.
Steve, thanks for the public service announcement. Is there anything else you wanted to mention to us tonight?
No, the main thing is, you know, treatment's rough. I finished my treatment in January, and it's tough, but it's worth it, and it gets better.
And it must be something that you have a passion for, to be sure and give support to others out there.
Well, I found out that when you're going through a treatment or having problems, it helps out to get with support groups. I also have been trying to work with LifeShare on getting organ donations, because we need organs too for not only liver disease but heart disease and other problems, and I just feel that it helps me by helping out.
Steve, thank you so much for calling tonight. We appreciate that. Any input there? I guess for people who are diagnosed with hepatitis, no matter if it's A right up to E, they are out there wanting to educate others as to what this mysterious disease or diseases are.
And it always helps to be in support groups. It helps to talk to other people who are going through the same thing. One of the greatest tragedies, obviously, that has happened to this country is this thing called HIPAA. And here I go on another bandwagon. And again, that makes it very difficult for us to allow patients to interact in the office, for instance, because you have to protect their identity and you have to protect their privacy. But patients want to help each other, and they want to let others know that you can do this and you can get through this very easily.
One way we do that in the office is when we start patients on their treatment for hepatitis C, because as we've heard over and over throughout this show, is that the treatment can be very difficult. And it is, in most cases, for 48 weeks, which is almost a year to go through this treatment. Right. We actually train our patients before they start their treatment in a group setting. We just don't use names so that we're compliant with the HIPAA regulations. And we hear over and over again from patients how that is very, very good for them, because they see the people that were in their class, and they do talk with each other, and some of them, you know, slip each other's phone numbers and things like that, and they like the support, and it is a lot easier to go through treatment if you do have somebody who's going with it as well, so you know you're not the only one having all those side effects.
It's like a team. Let's take Dean's question from Charlotte. Hi, Dean.
Hi, I'd like to ask the great doctor a question.
Go ahead.
I'd like to ask him a question about the combination of co-infection between HIV and HCV. Is there a cutoff level at the T-cell point or T-cell level as to when you will and will not treat someone for HCV? And I would also like to challenge all of the HIV doctors out there, if they would get on TV and talk about HIV as Dr. Reindahl has, I think people would understand about AIDS a lot better.
Dean, thank you.
And this is very, very important. You know, I have to say in the last decade, the HIV-infected individuals who are also co-infected with hepatitis C were in some ways disenfranchised because the hepatitis C was not addressed. And in all fairness, in a lot of cases, it was felt back in the early 90s that individuals that had HIV wouldn't live long enough to get into trouble with hepatitis C. Well, we now know that a 35-year-old that is diagnosed with HIV today, everything else being equal, will live a normal life because of the medications out there for HIV. So we're starting to now put an emphasis on, okay, there's a huge portion of these people who are co-infected with hepatitis C, and they can be treated. A lot of these patients now have negative viral loads for their HIV. Their CD4 counts are very, very reasonable to be treated, and they're good candidates for treatment. Unfortunately, the response rate isn't as good as for someone who doesn't have hepatitis, who doesn't have HIV, but again, we're starting to see more and more HIV co-infected patients cured of their hepatitis C. So I couldn't agree more with Dean. I think that these are people that need to be looked at now. They need to be seen. They need to have their hepatitis C addressed. And in fact, we are now seeing more and more of our infectious disease colleagues who are starting to do this. And again, back in the early 90s, it was felt that, gee, this is not the issue here. This is not the main thing that we should be looking at. And now that we can cure these patients, or excuse me, put these patients into viral remission with HIV, and they can live normal lifespans, now we're addressing the Hep C.
The other issue there, too, is that now that the HIV is so very well controlled, hepatitis C is one of the leading causes of death in the HIV population. Correct. And that's why it certainly has to be something that is addressed on a regular basis. There are some people who thought, you know, they might have more side effects because they're on so many drugs, but now we know that it certainly is doable.
We were actually involved in a very large co-infection clinical trial for patients with PEG, interferon 2A, and ribavirin.
Dr. Reindaler, our time is gone. Okay. You're always fascinating. You promise to come back?
We will come back.
Dr. Reindaler, Don Cunningham, thank you. We hope this show has helped you become HealthWise. I'm Joey Pop. Tune in next week.
If you would like support group information about tonight's topic or any HealthWise topic, call SupportWorks at 704-331-9500. For more information about tonight's guests, call the HealthWise information line at 704-371-8836. WTVI welcomes questions and comments about HealthWise. You may write us at HealthWise, care of WTVI, 3242 Commonwealth Avenue, Charlotte, North Carolina, 28205. Or you can email us at healthwise@wtvi.pbs.org. Joey Pop's wardrobe for HealthWise is provided by Dillard's at South Park.